his name is Dr. Gbenga Akinyosoye. He's a senior registrar from the Department of Pediatrics from Lagos State University Teaching Hospital, that's LASUTH, in Ikeja, Lagos. And today we're going to be talking about managing the complications of sickle cell disorder, specifically in childhood. You're welcome to the show, sir.
Thank you very much.
Okay, so last week we talked about managing sickle cell disorder in general. We talked about the complexities. You know, everybody has their different needs, their different experiences and things like that. But in the case of children, I would expect that it's even more unique and even more specific and at times challenging. So
Yeah.
can you shed some light on that?
Like you rightly said, children they pose certain challenges
Yeah.
being children. Sickle cell disease is also a challenging disease on its own,
Right.
and for managing children with sickle cell disease, sickle cell anemia can be very challenging
Right.
because one, having to communicate what the problem is difficult.
Right.
So most times we get to tell the parents what they can feel and we counsel them.
Okay. Okay. So what does counseling look like for a parent with a newborn that has sickle cell?
Yeah. Counseling is not just a single phase. It's not just a
Okay.
one-off thing. It's
Okay.
a series of things that would from time to time. So when we counsel them, we want to tell them about, okay, this is what your child has.
Right.
From diagnosis, we make a diagnosis of this is sickle cell disease that your child has, and these are the challenges that you're likely to face. These are the various ways the child can manifest and present, and these are the likely complications that you're likely to face vis-a-vis different age groups, and these are the things you can do.
Okay.
So like I said, it's not a one-off thing. We take them through the various complications that they can have, how to manage them. Some can be managed at home, really, and
Right.
that's what we're going to be talking about today.
Okay.
Then when they need to come to the hospital, what we do in the hospital, let them know.
Okay. So can you tell us a bit more about managing what can be managed at home, and then when does it get too extreme that we have to go to the hospital or the clinic?
There are many complications of sickle cell disease.
Yes.
It can affect almost every part of the body, so to say. So we divide the complications or the common complications. We call them things like crisis.
Right.
That's what everybody, common people know
Knows
it
them
as.
as crisis.
Crisis. So those crises, there are 4 common types of crisis.
Right.
The commonest one being the vaso-occlusive crisis,
Which
the one
is?
everybody calls the painful crisis, which is almost the commonest presentation.
Okay.
Almost everybody with sickle cell anemia would present with. So what happens with vaso-occlusive crisis? That they have painful episodes and can present with varying degrees of pains
In
from
all parts of their body.
in all parts of the body, really.
Okay.
Every part of the body. Can have varying degrees of pain from mild pain to moderate pain to severe pain and to excruciating pains,
Right.
so to say. So when they start presenting with that kind of pain, we advise, okay, there are various things that can trigger vaso-occlusive crisis in children with sickle cell anemia.
Okay.
Such as stress, cold, infections, extremes of temperatures,
Okay.
dehydration commonly.
Okay.
We find out that children that don't take in enough water, they are dehydrated and this predispose them to having painful crisis.
Okay.
And so the common thing we normally tell them is to increase their fluid intake, and which almost everybody with sickle cell anemia, you see them carrying packs of water to school and all that. That is just to reduce this trigger
Okay.
of
A crisis. Okay, but in the case of a child that's below the age of 6 months, how do we, as far as hydration is concerned?
They're taking, for example, a child below 6 months that is breastfeeding. They're taking enough
and it'll
breast
be
milk.
enough.
Yes.
Okay. Fair enough. Okay. So now you mentioned stress as a trigger.
Yeah.
Now, what does that look like for a child? Stress? Is it like not being able to sleep? I mean, what could be considered stress for a child?
Various things can trigger stress in children.
Okay.
We're talking about things like physical exercises,
Okay.
exertion, more than what he's used to doing, he or she is used to doing. We're talking about things like stressors from home, various stresses.
Okay.
The parents will naturally identify these and work on them.
Know how to manage them. Okay. So In the case that there's hydration, there's all of those steps being taken to take care of the child, is that a prevention of a crisis or is that treating? Because you mentioned that's a way to, manage it at home.
Yeah, it's basically a way of preventing.
Okay.
So it's to prevent them from having this kind of crisis.
Mhm.
Eventually, some still come, even after doing all this, they still have this crisis. So what we tell them is, your child is having this kind of crisis. We've told them the various things that can precipitate it. They've taken enough water. The child is well covered during cold period. The child is not exposed in any form.
Right.
He is not overtly having stressors and all that, and the child is still having some degree of painful crisis. We counsel them to start pain medications from home.
Oh wow.
Yeah.
Okay. So for a child, is that like child acetaminophen? Like what?
Yeah,
what would that be for a child?
For WHO recommendation is that they should start with non-opioids.
Right.
Like ibuprofen. Most everybody know what ibuprofen is. So we counsel them that after all these precautions, you can start your child on ibuprofen before coming to the hospital.
Okay.
Most of them, after starting the pain medications, the pain goes away.
Okay.
But for some, it's severe and excruciating. They need to get to the hospital. Then we start looking for other things that can trigger the pain.
Okay.
Is there an infection that we need to treat?
Right.
But we'll take that up from the hospital.
Okay. So when they come to the hospital when it's severe, when it's a really bad situation. Okay. So we've spoken about the physically managing sickle cell in a child. But then how do we address like the emotional or mental? Because to tell a 5-year-old, you can't really play football with your friends, or you have to pick and choose the days. How do you manage that, or how do you address that in a child?
No, don't get me wrong. I'm not saying they should not play.
No, they have to there's restrictions as far as like how much energy they can exert, right?
Yeah.
Okay, so then how do you now tell that child, don't run this fast, only run this at this pace?
It's because they are children. It's actually difficult.
It's hard,
they
right?
want to do everything every other person is, and it's fine because if they don't do that, it's going to be another problem.
Yeah.
So what you do as a parent is try and let them understand what this disease is about. Yeah, they can understand the type of disease they have and the things they can do in the interim to kind of play they can have with other colleagues.
Okay.
But we try as much as possible to discourage parents from saying that they should not play at all. They should not do this at all, which is very wrong.
Okay, so in the hospital, what does management look like? Tubes, or does it depend on the child and the age? Are those factors?
Yeah, when they come to the hospital for a vaso-occlusive crisis, a painful crisis, we would assess from history and ask, okay, how many times has a child had this kind of painful crisis in the last 3-6 months, for instance? What have you been using? What did you start when this child had this? We try to identify the trigger and work on that and see how we can counsel them. If we calculate the fluid they can take in a day, and we try to tell them that, okay, your child is not having enough fluid, you have to increase the fluid. We look out for infection, like I said. If there's infection, you have to treat. We look out for other triggers and we try to eliminate that in the child. Then we'll now scale up the pain. We can go as high as using opioids for them.
Yes, I was gonna ask that. So then how do you prevent addiction? Because opioids have a high addiction rate.
I agree with you. But it has been documented that we undertreat pain in sickle cell patients.
Really?
Yeah.
Oh wow.
There are several studies that have shown that even the opioids is not enough, and that most times we try to undertreat them. And there are various all over the world now. There are various ways of giving them pain medications. We talk about pain controlled analgesia. That is, they tend to get the pain medications even when they're feeling pains.
Okay, so they take it when they're not in pain to prevent potential pain, but to
manage. When they are in pain, they can. It's a form of pain that you can press
and then it pumps into them. Okay. But that we don't necessarily have that here yet.
Not yet.
Okay. But in the case of a child, a 3-year-old, I guess you have to do the counseling for them to, or tell them if it's that severe,
Yeah.
they have to be aware that they can.
Yes.
I guess in those cases.
Yes.
Okay, so counseling, is it different based on the age group?
Yeah.
Because I know you said it's like phases, but
Yeah.
is it parents of children from 1 to 5, parents of children from 5 to 10?
For example, the way you're going to counsel a child less than 5 is going to be different from the way you're going to counsel a teenager, for
Okay.
instance. The
In what
teenager
way?
is more aware of what he's facing, is more aware of the disease process
Yeah.
than an under 5. For the teenager, for example, in my own center, there's what we have a teenage
Wing?
sickle cell group.
Group, okay.
Yeah, so they come together without the parents, really.
Okay.
They come together, they talk about their experiences managing this disease.
Like a support group.
That is a support group.
Okay.
Then they will teach them about the complications they don't know already.
Okay.
And we'll try and keep them up to speed about recent developments. Then we try to use them to now talk to the younger ones. Do you understand?
Right. It's like their older brother or sister talking to them or advising them.
And we found out that has worked very well.
Okay. So, even with the counseling, because you mentioned the support group, but in terms of parents, do you kind of, when they're at the teenage or preteen phase, you now focus on having the discussions with the children, or do you still bring the parents into the loop apart from the support group? I understand parents are not in the support group.
And like I said, it's in phases. Of course, you have to get the parents. You have to take them all through the process. Okay, this is what you do for your child. This is what you expect them to have. This is what we do. This is what you're supposed to do at home.
Right.
These are the things you can do. These are the options that we don't readily have now that you can explore later.
Okay.
So we take them through all those processes.
Okay. So then, how is diet, like what they eat? Does it affect specifically children? Are there things that could potentially trigger, I don't know, an active ingredient in some food or something like that?
Okay, so about diets, because children generally, for any disease process, we tend not to restrict them from eating anything.
Okay.
Because that in a way is kind of stigmatization, and it's going to be a problem. And you might have a lot of difficulty in managing them. But in terms of fluid intake for them, we try as much as possible to tell them not to take in fizzy drinks. Or most drinks, because that is going to in its own make them dehydrated.
Because the sugar in it. Yes.
And that's going to affect what you're trying to manage. And so of course they'll come up with more pains and all that, and more crisis. So for that, we tell them that you take more fluid. Water specifically.
Okay. So sleeping cycle for children, managing their sleeping cycle, it's important, right? I would imagine. So how many hours, or is it the same amount as a child who doesn't have sickle cell?
There's no difference.
Okay.
There's no difference. They're children, they should enjoy their sleeps normally. And they should, there's no restriction.
Okay. No, I wasn't even asking restriction, like do they need more, like an extra hour or something like that?
No.
Okay, fair enough. Well, I guess we are still here. This is Surviving Sickle Cell, and we're talking about managing sickle cell specifically in children. We talked about managing it in general last week, but now we want to go down to specifics with children, and I am here with Dr. Gbenga Akinyosoye, and we're going to be talking a bit more about how to deal with it, because from a parent's perspective, it's just as severe, just as tasking as a child. So what are the common things you hear from parents of children with sickle cell?
Okay, well, we've heard various things, many things, but some of them were like, okay, in the early part, is he going to survive this? Is there a cure for this? Can he live a normal life? Can he go to the university, for instance? Can he go to a boarding house? Can he eat anything, like I said earlier? Can all sorts.
Okay. So in terms of management, those are the general questions or concerns that they have. Will the child have a normal life? But we've made it clear that they can have a normal life. It's just like managing or watching over any
Any
growing
growing
child.
child
Yeah. Okay. So, any more information or details in terms of management
of
from the
complication.
parents? Yeah, exactly. Specifically the complications.
Yeah, there's another important complication I should mention.
Okay.
We call it sequestration crisis.
Okay.
Explaining sequestration crisis.
Okay.
What occurs in what happens there is that the spleen
Mm-hmm.
tends to is an organ in the body,
Yes.
tends to pull up a lot of their blood,
Oh.
and it's a very severe complication of sickle cell anemia. And when that happens, they find out that a child that was otherwise well
Mhm.
suddenly gets so pale, white all over, breathless, tired, fatigued, and there's a drop in their PCV, back cell
Okay,
volume,
yes,
hemoglobin concentration.
Yeah.
Then there's a swelling in the left part of the tummy,
Hmm.
yeah, from the spleen. So it gets bigger by pulling out a lot of blood, and that can be
Right.
life-threatening in children, especially those under 5 years.
Yes, the younger ones. Yeah.
So what we do is most times when they come to clinic is to let the parents know how they can actually feel the spleen.
Feel the spleen.
Yeah.
Okay, can you explain that?
Yeah, like I said, is on the left side of the tummy. So most of them they would know that okay, this is the extent of the swelling, and they can measure.
They can see it.
They can feel it.
Feel it.
They can feel it and measure the spleen themselves. So when it's getting rapidly bigger,
Okay.
they know that there's a problem, and of course they know that they should come to the hospital,
Okay.
and they'll take it up from there.
Okay. And there's a draining process there. Maybe not.
Draining process.
Like, will the spleen be drained, or how do you?
No, it doesn't
now-
get drained. It goes back on its
It just
own.
goes back to normal.
Yeah, but the problem is because the spleen has pulled out a lot of blood from the circulation.
Oh, okay.
So it's like not having enough blood at that time, and
I
of course,
understand.
certain complications can arise.
Okay. So, in terms of kids, especially teenagers, we talked about stigmatization.
Yeah.
How do we manage that as people who are in society, whether we're teachers, we're friends, older siblings? How do we have conversations with people who teenagers who are having sickle cell, or not even teenagers, I'm hearing even as young as like 5 or 6 year olds being teased or ostracized? What part do we play in it, as the older ones, as adults?
It's very wrong to ostracize anybody with sickle cell anemia. Number one, it's not their fault that they have sickle cell anemia. It's something that as high as 1 in 300 Africans have.
Yeah.
So it's with us, really. Being aware of the disease process is something I know that most foundations, Sickle Cell Foundation, and most teaching hospitals are working on. Just that when you are aware about what the disease entails, you know that okay, it's not something that is communicable.
Yes.
It's not something that you can get by just getting close to them. You should show them love because they need that kind of love. They will be in and out of school for some time because of the various crises that they go through. But that doesn't mean that they are not normal. They will still, most of them still live a normal life.
Yeah, there's that notion or I guess superstition that it's contagious. If they have it in this family, as if it's a communicable disease.
It's not a communicable disease.
It's in nowhere communicable disease.
It's nowhere.
And avoiding especially children like the plague, as if they have the plague, it affects their self-esteem. It really impacts them when they get older.
Yeah.
So from the adult's perspective, it's just for us to have those conversations with all children or all young ones, right?
Yeah.
About what it is, whether we have it or not, right?
Yeah.
Okay, just so that we're aware. Okay, guys, so we're going to take a quick break. We're still here on Surviving Sickle Cell. Don't go anywhere. We'll be right back. Sickle Cell. This is done in collaboration with Sickle Cell Foundation Nigeria in honor of our beloved Tosin Buckner. I'm here with Dr. Gbenga Akinyosoye. He's the Senior Registrar, Department of Paediatrics at LASUTH, that's in Ikeja, Lagos. And we've been talking about managing complications of sickle cell disorder, specifically in children. So, sir, would you mind just walking us through again? So we talked about the physical, the mental, the emotional, then we now started talking about stigmas and stuff. So can you just, bring it home for us?
All right. So we talked about sickle cell disease, sickle cell anemia. In children now, we talked about them having various complications that can arise. We talked about medical complications that they can have, like vaso-occlusive crisis, a painful crisis. And we talked about things that can precipitate them, things like dehydration, things like stress, things like cold, extremes of weather, infections. Then we talked about starting avoiding these precipitants in them to avoid painful crisis. We talked about them drinking lots of fluid, water, avoiding fizzy drinks in children. We talked about sugary drinks. We talked about keeping them warm, not exposing them to cold, extreme conditions to avoid them from having painful crisis. We talked about them having things like splenic sequestration crisis. We talked about how we counsel parents to monitor this splenic size, and once they notice it's getting bigger, to present to the hospital.
Okay, so and even with that, so there's a measure, or there's kind of like a threshold before it needs to be taken to the hospital, because with the right counseling, right, there's some things that parents can handle at home.
Yeah, especially for those having pain
specifically. Okay.
Pain specifically. Then we talked about the psychological aspects, especially regarding children. We talked about not stigmatizing those that have the disease. We've talked about them presenting to the hospital to register for a clinic where they can be followed up regularly. That's very important.
Okay, so that process, because a lot of people are unclear about hospital registration. Some people also may think, well, will they take my child? Can they handle them? That kind of thing. So what's your advice for finding that right facility to properly care for the child and that registration process?
I would advise you go to any hospital where there's a specialist.
Okay.
A specialist is someone that manages sickle cell disease, sickle cell anemia. Call them pediatric hematologists. Those children, where they would book your child, register in the facility, then they start seeing for follow-up. They would run some basic tests to have a background, baseline investigations, and they will counsel you appropriately and walk you through the process, so to say. And like I said earlier, counseling would be in series, not just a one-off thing.
Right. Okay. All right. Well, there you have it, Lagos. This has been Surviving Sickle Cell. Thank you so much, sir, for joining us. It's been very insightful, and I hope we took a lot away, especially the issue of stigma and stigmatizing children. We don't want to be the ones responsible for them having issues with self-esteem and things like that, because they're managing so much. This is in collaboration with the Sickle Cell Foundation Nigeria, and it is in honor of our beloved Tosin Bucknor. Thank you guys so much for listening. Until next week.